So we have Dr. Lucky Seekon in studio with us today to talk more about this process. She is a double board certified OBGYN at RMA of New York Fertility Clinic, and of course, my doctor as well. Dr. Seekon, thank you for coming in.
Thank you for having me.
Appreciate it so much. It's so great to have you. Let's talk about the attrition rate, because where we kind of ended in this process is very happy, very hopeful about our situation, but we were a little surprised. I mean, that drop-off rate from eggs to healthy embryos was over 60% for us, which I know is kind of fairly normal. Families go through a lot in this.
Yes, I think a lot of people don't realize how inefficient human reproduction is. And so there can be a lot of confusion, especially when you think about egg freezing and expectations about the fact that one egg does not make one baby. Not every egg is going to survive the thaw. If you're starting with frozen eggs, the majority will, but you're going to lose some at that stage. Not every egg will fertilize. It's typically 70 to 80%. And of those that fertilize successfully, about 60% typically make it to the embryo stage. And no one makes perfect embryos 100% of the time. Even in your 20s, 20 to 25% of embryos may have genetic imbalances that prevent it from becoming a healthy pregnancy. So you have to really counsel patients appropriately so that they understand and have realistic expectations about how many eggs they're starting with and what that might mean down the line.
We should talk about what's been in the news lately. The freezing embryos and eggs, the process has come under threat. Talk about why this is so important for families that are looking to grow their family.
Right. So when you freeze eggs, you're freezing potential. But when you're actually trying to help a patient get pregnant with IVF, you need to turn those eggs into embryos. And the reason this has come under threat is this idea of personhood, assigning a personhood to embryos, and not realizing that even when you get to the embryo stage, not every embryo is healthy. And even the healthy ones that are tested, because you can do genetic testing on embryos, not every single one of those will implant. So when I counseled you about where we landed and the number of embryos you got, even then I said, okay, based on how they look under the microscope and the test results, you know, they might have about a 60 to 70% chance each of actually implanting.
Yeah, and you knew that was a big conversation for me. I mean, it took me a while to make that decision as a person of faith, seeing a person who's very much in the news and seeing all that conversation, but you did counsel me so well. We only have like 30 seconds, but let's just touch on the PCOS of it and treatment options. You've been helping me through that.
Yes, so PCOS is extremely common. It affects about 10% of the population, and it's a condition that can predispose you to having irregular ovulation. And a lot of people aren't aware of the fact that they only ovulate one egg every cycle, and if you never know when that's going to happen, it can be really hard to time your attempt, and it can make trying to get pregnant even less efficient than it already is. So anytime someone has any sort of gynecologic issue that could predispose them to infertility, doing something like this as a backup plan in case you should ever need fertility treatment to build your family, it just gives you a really great head start and ensures that you will be successful.
Yeah, the way you kind of helped me understand it was I most likely have less chances to get pregnant a year. We don't know when those chances are, and we don't exactly know how many, which just makes it all tough, as you said, inefficient.
Exactly.
Dr. Seekon, thank you for coming on today, and thank you for treating me. It's been such a joy getting to spend so much time with you.
Thank you so much, Savannah.
And clearly a conversation that so many families are having right now. So glad we could have it here.